Greetings. On behalf of Georgians for a Healthy Future, I want to thank you for taking the time today to review this presentation. Today we will be discussing the Patient Protection and Affordable Care Act as it relates to the health insurance marketplace in Georgia. This presentation is specifically designed for healthcare providers as well as their clinical and office staff. Our goal is to provide you with a basic overview of the health insurance marketplace, equipping you to answer patient questions and direct your patients to the correct resources. By providing answers to your patients and helping them get to the right resources, you play an important role in making the health insurance marketplace a success in Georgia. So what is the Affordable Care Act? The Affordable Care Act is expansive healthcare reform passed in March of 2010 and upheld by the Supreme Court in 2011. Implementation of the health insurance marketplace has started and will continue over the next several years. The Affordable Care Act makes reforms to Medicaid, Medicare, and creates new programs, including the health insurance marketplace, also called the Health Benefit Exchange. This will be the subject of today's presentation. So why was healthcare reform needed? In the U.S., people typically have insurance either through their employer or are covered by a government program such as Medicare or Medicaid. Unfortunately, 50 million people do not have any health insurance at all. This problem has been growing. Less employers are offering health insurance as a benefit, and health insurance is expensive, meaning that employees sometimes still can't afford it even when it's offered. Higher unemployment rates also result in less people with access to private insurance. And finally, self-employment and part-time jobs also cause less people to be able to access insurance in the private market. As a result, more people are qualifying for Medicaid, but there are insufficient federal and state funding to keep up. Also, it's important to remember that qualification requirements exclude many of the uninsured. Simply not having insurance or being poor does not mean that someone qualifies for Medicaid. All of this together means more people without insurance. So what does the Affordable Care Act do to help people get health insurance? First, if people do have affordable insurance through their employer or through a government program, they should keep that insurance. If people do not have access to insurance, they should have a way to buy it in the private market that is affordable. Once fully implemented, the Affordable Care Act, along with the health insurance marketplace, could help up to 32 million Americans get insurance. However, the Affordable Care Act and the health insurance marketplace can be confusing. Patients often come to their healthcare providers and their staff with questions. Our goal is to prepare you to briefly answer those questions and then direct patients to resources where they can get more answers. Many patients will not go any farther than their healthcare provider with these questions, so your responses to patients can help them obtain affordable health insurance. So first, patients want to know if they can get insurance now. The good news is that while health insurance may still not be affordable or available to everyone, many people who don't currently have health insurance now have the opportunity to buy it through the health insurance marketplace. Some people will also qualify for reduced rates. So what is the marketplace? Each state has a health benefit exchange, which is the marketplace where individuals and families can buy insurance. It doesn't matter where you work, how much you work, or if you have pre-existing conditions. Anyone can see their options in the marketplace. In the marketplace are private health insurance plans that cover essential health benefits. As you can see, this includes primary care, emergency services and hospitalizations, maternity and newborn care, mental health services, prescription medications, preventive and wellness services, as well as chronic disease management and pediatric care. Individuals choose between bronze, silver, gold, and platinum plans, but regardless of which they choose, all plans in the marketplace cover these essential health benefits. So how does someone pay for insurance purchased through the marketplace? After a person finishes the application, he or she will see all of the possible options and how much each will cost. Costs are lower for people who make less money and have larger families. Everyone making less than 400% of the federal poverty limit qualifies for a subsidy. That is money from the government, including a tax credit or discount, that decreases the cost of the health insurance plan. The individual purchasing the plan then decides how much they want to pay in premiums versus out-of-pocket expenses. The premium is the amount of money an individual or family pays each month to have insurance. Out-of-pocket expenses are the amount someone must pay at the time they receive health care. Plans with the lowest premiums are the bronze plans. They have the highest out-of-pocket expenses. Platinum plans have the highest premium, but have the lowest amount of out-of-pocket expenses. So for patients that are interested in enrolling, how do they do so? There are several options. First, they can complete an application online at www.healthcare.gov or by phone at 1-800-318-2596. However, there are likely people that still have questions or wish not to enroll via the internet or by phone. For these patients, a great resource is our health insurance navigators. These are people with special training who work at different clinics and organizations throughout the state who can help people enroll and answer their questions. Enrollment is open now and ends March 31st of 2014. Open enrollment begins again in October of 2014. Some individuals and families may qualify when open enrollment is closed due to a qualifying event. So for those people with additional questions, how do they locate a health insurance navigator? First, you can help your patients learn that these navigators have special training to help answer questions about the marketplace and can help people enroll in a plan. Navigators are paid by the government, so they do not work for the health insurance companies. Their only job is to help potential enrollees, and you can reassure your patients that they will not have to pay the navigator at any time. Call 855-899-6092 to find a navigator in your area. Finally, reassure patients that meeting with a navigator does not mean they have to enroll. They can ask their questions, see their options, and then make the decision that's best for them. Many people want to know if they'll lose the insurance they currently have, or if they have to change to insurance through the marketplace. If a person has insurance through their employer and their employer continues to offer that benefit, they can keep that insurance and are covered in regards to the mandate. This also applies to individuals with Medicaid or Medicare. As long as they continue to qualify, they can keep that insurance and are covered in regards to the mandate. However, there are many individuals with private insurance that have very expensive plans or plans that they're not happy with. They may want to know if they can change to a marketplace plan if it is more affordable than their current insurance. Anyone can explore their options in the marketplace, but remember, if you choose a marketplace plan, your employer will no longer pay part of that premium, so it may be more expensive than your current option. Also, you may not qualify for cost savings, the subsidies and discounts, even if you earn below 400% of the federal poverty limit if you have insurance through your employer. However, someone can qualify for lower costs in the marketplace if the insurance offered through their employer is not affordable or does not meet minimum value. A plan is affordable if the self-only coverage is less than 9.5% of the individual's annual family income. A plan meets minimum value if the insurance pays at least 60% of covered medical costs. As a healthcare provider, I have been asked several times, am I going to jail if I don't have insurance? No one is going to jail, but the new healthcare law does include a mandate. A mandate is a legal requirement that everyone have health insurance. By 2016, U.S. citizens and legal residents will be required to purchase insurance or pay a tax penalty equivalent to 2.5% of their taxable income. However, there are several exemptions to this mandate. Exemptions include religious opposition to health insurance or being a member of an Indian tribe. If your family income is below the threshold to file federal income taxes, which is about 10%, $10,000 a year for an individual, or $20,000 a year for a family, you are exempt. Also, if you would have to pay more than 8% of your annual income to purchase health insurance, even once subsidies and discounts are applied, you are also exempt. Patients may also ask if they can now qualify for Medicaid. They may have tried in the past and been unable to qualify and want to know if health care reform has made it possible for them to get Medicaid. In some states, more people will be able to get Medicaid. The Affordable Care Act includes federal money to expand Medicaid to all individuals under 65, making less than 133% of the federal poverty limit. However, each state gets to choose whether or not to participate in the expansion. As of this time, Georgia is not participating in the Medicaid expansion. People who already qualify for Medicaid can still get it, but those that did not qualify before the Affordable Care Act will not qualify now unless their individual situation changes. So how can healthcare providers make the marketplace successful in Georgia? First, encourage your patients to look at their new options for health insurance. It can be as simple as going online or visiting with a health insurance navigator. Patients can see their options and find out if health insurance is now more affordable for them. Also, help patients understand the value of having health insurance. Health insurance is both a health protection and a financial protection for patients and their families. And finally, know where people can go to get help. Hand out the number to find an insurance navigator and encourage patients to ask questions and get more information. You play an important role in helping your patients access affordable health insurance. We want to thank you for taking the time today to view this presentation. Please visit our website, healthyfuturegeorgia.org, for more information and resources, and feel free to contact us anytime if we can help.